All right, well, it's 12 o'clock. Thank you for all who are joining. Today's uh, presentation will be by Dr. Adam Rosen, a member of the Department of Orthopedics and a specialist in joint replacement. But today's topic will be adrenaline junkie to burnt out physician, surviving a career in healthcare, something very important to all of us. At the end of today's discussion, Dr. John Fisher will join briefly to provide some information regarding access to resources in this regard. So if you're ready, Dr. Rosen, I'll let you take it away.
Yep, perfect. Thank you. Thanks everyone for tuning in. And as Dr. Mason said, here's the topic that we're going to talk about. As you can see, 25 years in, so I've been doing this for a while. And I know sometimes grand rounds, there's topics that are far outside of our specialty. And we have lots of work to do and clean in baskets and emails. But this is a topic that's really close to my heart. And I think it's something that affects all of us. Because if you're lucky enough to not be burned out, the odds are your partner is. So there's a lot of things that you can take away from this. And looking back, I really think there's kind of three kinds of doctors that are out there right now. There's sort of the 62, 65 and up. They're doing this because they love it. Their house is paid off. Their kids are out of college. Their 401k is fully funded, but they're here because they want to be here. And the younger crowd kind of broken into two. There's those of us that are quite new to this that are trying to figure out how do we buy a house like here in San Diego, pay off our medical school loans, raise family, and build a practice. And, those of us sort of mid-career that are figuring out, how am I going to pay off my mortgage? How am I going to get my three kids through college? And what's my end game? And this is what I wanted to talk about because I don't normally get nervous speaking, and I've spoken at national meetings, but this made me a little anxious because this is personal and this makes me vulnerable. But it's something that I have spoken about more and more, and it's getting a little bit easier. And what I take away from this is every time I talk to a group, there is somebody, usually more than one, that reach out that really thank me because this has helped them in many, many ways. And I hope that one of you listening really take away from this something that's really important and helpful to you going forward. These are my disclosures. And, it's kind of auspicious because this is National Suicide Prevention Awareness Month. And today, September 10th, is actually Suicide Prevention Day. And, a lot of people actually are not even aware of the 988 hotline. So it's something that I always try to talk to my patients about, especially those that struggle with depression and anxiety. Now, this is your homework. So if you like listening to podcasts, listen to Dharma Lab. This is Richie Davidson and Cortland Dahl. They're researchers at University of Wisconsin-Madison. And I was just listening to this yesterday on my walk. And Court started out by saying, when we are experiencing burnout, very frequently we feel as if we're a failure and we feel as if there's a problem with us. We did something wrong. And that's the big thing that I've learned, and I try to get people to understand, is that very often it is the system in whatever area you work at, whether or not you're in school or a business, that burnout usually is due to factors that are outside of you. And they covered this great article that was recently published in JAMA, so you can check it out in your free time. Now, the goals of today is really, I want to share my story with you, and this is what really makes me vulnerable. But I'm hoping that one person out there just feels less alone, that they kind of say, wow, I'm not the only one experiencing this. But more importantly, if you can stick around to the end, I want to offer a lot of skills and resources, and then Dr. Fisher is going to share a lot of the resources that we have here that you can access. Now, for those of you that don't know me, I'm Philadelphia born and raised. I did my fellowship out here in 2005 and joined the practice in 2006. I loved my job and I worked ridiculously hard. I did not mind working late into the night and operating on weekends. I kind of loved getting a phone call at my kid's soccer game because someone had a hip fracture they needed help with, and I was going to leave at the end of the game and get to go to the operating room and operate on a Saturday afternoon. I did lots of research and I was really involved and I was having a great time. And during COVID, I had always wanted to create a podcast. So I created two podcasts. This one was for orthopedic residents and fellows, and one was for patients. And this is the one episode that I shared on both platforms. And at the time, we had residents from the Navy, orthopedic residents. And one of them reached out to me after hearing this episode because this spoke to him so deeply because he was really struggling. And he was an ex-Navy SEAL. And I mean, if you want to talk about stereotypes, I mean, here's an orthopedic male surgeon, ex-Navy SEAL. I mean, this is supposed to be like the strongest person on the planet. And if this guy was struggling it really made me feel, wow, there's all of us could be struggling if this guy is struggling. And he had asked me to speak at the Navy Wellness Symposium, if you may have seen that on the title slide that I barred out. And unfortunately, I was putting together this talk about burnout, and I failed to recognize all of the things that I was researching to talk about at this meeting. And the Friday before, I had a nervous breakdown, what we would know as a mental health crisis, and I was unable to attend and give that lecture. When I was doing that workup, I found all of these studies that looked at burnout that was not just in residents, but it was in physicians. It even went back to medical school. And I would debate that a lot of this anxiety issue even occurs back in preschool, middle school, high school. We definitely, I'll talk about this later, have this perfectionism issue. It's why we got to where we are, right? But you had to do great in high school, and then you had to do great on your SATs and do great in college, great on your MCATs. And all along the line, you had to excel, and failure was not an option. As I was doing some research too, I found this article that some of the older doctors in our area had the experience, know Dr. Lagasse, and he wrote this incredible op-ed piece in 2000. So we're talking, 25 years ago, and I'm going to share some of the things that he talked about, because unfortunately, none of those things have improved, and all of those things have gotten worse. Now, the good news is physician burnout rates are below 50%. The bad news is that just until recently, more than half of us are burned out. And if you're burned out, you're more likely to suffer from depression. You're more likely to have marital issues, drink more, substance abuse, and you're more likely to make a medical error. And that becomes a big issue with what we're trying to do when we try to take care of our patients. The other big issue is we're seeing a huge number of doctors leave the field. So you're seeing doctors retire early, go non-operative if they're surgical, go part-time. And even studies are looking at medical school students, and a majority of them are not planning on going into clinical practice. So we're having an issue with patients being able to access healthcare, and it's only going to get worse. Now, for years, I always said that I loved what I did. I loved what I do, but I hate my job. And I loved taking care of patients. I loved that interaction in the room. I loved operating. My wife always commented on, wow, you've always loved teaching. But over time, all of that got harder and it got worse. And it wasn't the patient stuff, it was the other stuff. Those are the things that I started to hate. And all of us are at risk of burnout. These are all of the factors that we potentially are having hit us. Again, the burnout is not you. The burnout is the things around you that are affecting you. And you can see pretty quickly here, you can look at your specialty and figure out where you fall in that percent burnout rate. Orthopedics is pretty low, but it's nowhere near zero. It's just under 40. And I was one of those. And a better term, I think, is talking about what's called moral injury. And we saw this most frequently during COVID. So a lot of nurses in the ICU were suffering moral injury. They knew they had the knowledge and the skills to take care of patients, but they were being asked to take care of more patients than normal, with less resources than normal. And the patients that they were caring for were getting sick and dying, not because they did something wrong, but because they didn't have the things that they needed to do the job that they were used to doing. And the same thing happens with physicians. Now, becoming a doctor was something that I'd wanted to do from a young age. Even as a young kid, my idea was wrong. I actually thought being an orthopedic surgeon was I could wear pajamas to work and play with plaster in Paris. And things changed over time, but I understood that this job meant I had to be responsible. And I understood that I would work long hours. And I understood, and I was really good at multitasking. I also understood that I would have to continue to learn for the rest of my life, because medicine and science move quickly. And to stay on top of things, I would constantly learn and practice my art and hone my skills. And it was something that I knew I was getting into when I joined this profession. The other thing that I knew and I learned and I really appreciated was the teamwork involved. But this is where, for me, things started to go south. Around the time of COVID, my scheduler went back to school. My nurse had personal issues and was out for a month dealing with her family. I lost my medical assistant at my satellite. In the hospital with COVID, most of our surgical teams left. So every 3 months, we were having new travelers come in And the team that I really relied upon to help me care for patients and do my job was upended. And when I was trying to go through my mental health crisis and heal, I spent a lot of time journaling. So a lot of the things that I'm going to share with you, these are things that affected me. And speaking with other physicians around the world, not just in the US, many physicians have dealt with the same thing. And this is the thing that I'm hoping that if one of you is struggling, you start to say, wow, he was dealing with this. I'm dealing with this too. And, there's an inefficient system. Most of us have learned to be very efficient. And I'm sure each department could probably tell me one or more of the things that affect their system. For me, example is our x-ray department. We have so many x-ray machines and so many x-ray techs. That is our rate limiting factor. So if x-ray is behind, I might catch up with all my patients, and then I'm sitting here waiting for a patient because they're caught up in x-ray. So my option is, okay, I can see less patients, and then patients complain that there's no appointments, that they can't get in to see me for months. Or I can see more patients and then get stuck like this in this bottleneck. And then all day I'm apologizing to patients because patients are upset because they got here early for x-ray, but they're now waiting and their appointment is an hour, hour and a half behind where it was actually scheduled. Now, the other issue is the electronic medical record. I mean, we could spend a whole day talking about the EMR, but this, I believe, is one of the biggest issues with burnout, because this was an issue with burnout prior to COVID. And I would say that we weren't given informed consent. We were not told by the government and these vendors about the risks and benefits of an EMR, but we were forced to use it. Now, I always tried to problem solve. So I would identify an issue, I would tell people why it's an issue, I would offer a solution, and I was constantly told, create a ticket. And after so many tickets, I was told, hey, back off. And what I would hear later, 6 months down the road, a dozen other people complained of the same thing, and they would have to fix it. Now, the other day, I actually timed me badging in a room to pull up Epic, to pull up a patient's chart, to pull up imaging, to pull up the x-ray, to get Stentor to load, to look at the images with the patient, 32 seconds. Now, if I say 30 seconds and let's average 20 patients a day, that's 24 hours in a year of simply waiting from the badge to the point where I can actually look at an x-ray with a patient. And for those of us that are old enough that we used to carry a notepad in our pocket, I could write a script in less than 10 seconds. Now it takes 18 to 21 clicks, and I have to use my phone to do my authorization. Patient messaging, and this is the thing that's been looked at a lot, has increased 157% since COVID. And a lot of institutions are now charging patients for patient messaging. And then the in-basket that we all love and hate. Now, this quote, I believe, was great from the Hill. Even if you are just finished brain surgery, at the end of it, in order to get paid, you must be a typist. So physicians have become the most overpaid and overeducated data entry clerks in the world. But it's part of our job. And what I found over time is I was getting more and more stressed that I kind of backed out of committees that I was involved in, but I still have a lot of paperwork, and we still get faxes all day. You have to sign things for physical therapy, and patients want a DNV application and disability paperwork and work releases. So that is one of those extra things that we're doing. And some of us are involved in a lot more committees and have a lot more administrative work on top of their clinical practice. And this is our motto here, right? Philanthropy, research, and education. And I've always tried to be cutting edge. But as a physician, I found cutting edge material like augmented reality and this novel irrigation wash that 4 or 5 years ago I tried to get in the door, and I hit wall after wall after wall. These things are still being worked on to try to get in. So some of my partners will have the ability to use these in the operating room. And for me, I missed out on consulting opportunities because working with companies, you can't really be a consultant if you're unable to use the product in the patients that you care for. And then insurance companies, all day my staff was trying to set up these peer-to-peer reviews, and I'm trying to fit a peer-to-peer review phone call into a busy schedule, either in the operating room or the office. And patients that I was responsible for caring for, patients that came to me and expected me to help them, I'm now finding out that their MRIs are denied and their surgeries denied and they're in pain. And I feel as if I'm the responsible party, and I felt guilty. Now, I personally dealt with other factors too. During COVID, we had lots of supply chain issues. This happened worldwide. And all day I was going in and not knowing what drapes I was going to have available and what instruments I was going to have available. And for a while, we had to use different bone cement. And then, like staffing shortages everywhere in hospital settings, on the floor and in the operating room, sterile processing had a lot of issues, and we had a lot of bioburden. So I'm trying to be hyper vigilant to take care of my patient and prevent things that could cause an infection. And every day I have to be the eagle eye to look for these things, which were things that were not present prior to COVID, or if they were in a much smaller percentage. And then for me personally, I had a surgical complication. I prided myself on always having complications lower than the national average. But a lot of patients don't realize that the physical and mental toll it takes on us as a doctor when we care for a patient and they get an infection. Because we take that home with us and wonder, what did we do wrong? What could I have done differently? How could I have prevented this? Did I make a mistake? And situational awareness. This is a term that we talk about in scuba diving. It's a term that we talk about in skydiving. It's a term we talk about in airline pilots. So for me, my job in the operating room is to focus on the task at hand, to do a knee replacement and work on the surgical site. But what I found is that I became hypervigilant and I had to look at these new surgical techs and what was their sterile technique. And they didn't know the steps. So I had to point out the instrumentation. And now I have new equipment and I'm trying to figure out how to do it. And it took my attention away from the task at hand. And it started to make me nervous as to whether or not I was going to make an error because my attention was taken away from the important thing, which was the patient in front of me on the operating room table. And on top of that, I was served papers. So I had a lawsuit. I was the second opinion for a patient that had a surgery at another institution in Southern California. I didn't do anything wrong. And it turned out that a person that was hired by the lawyers looked at it and basically said, not only did I do everything right, I actually went above and beyond. But I'm told you can't look at the chart. You can't talk to other doctors that were involved in this patient care. Don't call the patient. And I lost sleep. And again, I wondered, should I have done something differently? And I had to talk to lawyers. And you start to second guess yourself, especially when someone else comes in with this. And it's something that young doctors usually aren't told much about. But when you are hit with a lawsuit, even if you do nothing wrong, again, you still feel guilty. And then on top of that, I get these Press Ganey scores every month. So if this was my kid's report card, I would be ecstatic. Good job. But we're now given this card and I see this 96.4, and then I'm supposed to believe based on the red that I did a bad job. And we create this unreasonable expectation, like we always have to have 100%. And again, I've talked about this before. Many of us got to where we were because we suffer from perfectionism. It is how we became these high achievers, but it creates stress. This activates our sympathetic nervous system. This can cause mental and physical stresses on our body, and it's not a healthy loop. This is a negative feedback loop that can be harmful to us over time. Now, the other thing is trainees. So for those of us that work with residents and fellows, it's a really, really rewarding thing. This is a recent editorial that I read, and we have great fellows. The problem is, if you work with fellows and residents, occasionally you get those that really need a lot of work. And the hard part for me was when that happened is, how do I hand over the knife? How do I give the responsibility to a fellow to take care of a patient? Because it's part of the learning experience, knowing that I can do it better or faster, or there's a potential that they might make an error and then we have to treat the mistake because I'm the captain of the ship. At the end of the day, it's my responsibility. It's my fault. So for those of us that have trainees, this is another stressor and something that I did deal with. The other thing is, we are now working harder for less. That I would say that my job definitely has gotten harder over the past 25 years. And this is the hard part, right? MGA standards, we're getting paid at around 50%, but we're constantly told we're in the top 10%. Why aren't we paid at the 90% rate? In San Diego County, for those of you that don't know, with Medicare, we're still not looked at as a city. We're still rural, and I don't have any control over that. But on top of that, I'm trying to run a business. I'm RVU based, and then I have no shows, don't get paid for that. Basically, wasted time during my day where I'm not generating any revenue. And then all of this messaging, and I'm trying to answer, basically giving out medical advice for free. And at the end of the day, I'm still trying to pay my bills at home, which is not cheap living in San Diego. So these were things that I worried about. And how many more patients can I see? How many more surgeries can I do to make sure that I have enough money to support my family and support my kids? The other thing is that we are taught, maybe indirectly, to turn off our emotions. We might be in a room, say with a patient, if you're an oncologist and you're talking to someone who's being put on hospice, and they only have a few months to live. And then you walk out, you take a deep breath, you knock on the next door with a smile on your face and you say, "Hi, how you doing?" to the patient who's now in remission. So we don't have time to process these difficult patients. Sometimes we have to take a deep breath. And I always kind of jokingly say we have deep breath patients and double deep breath patients. Sometimes you leave a room and it was tough, and you walk out and shut that door and you just take a deep breath. And other times, you know the patient, you've seen them before, and you know this is going to be a tough one. And before you walk in the room, you take that deep breath and put a smile on your face and walk in. And some of these patients require that deep breath on the way in and out. But what we do is we tend to detach from that emotional side because we can't be that emotionally involved with every single patient and get through the day. Now, for me, I was starting to feel that I just didn't have enough time. I didn't have enough time at work. I didn't have enough time for my family, and I didn't have enough time for myself. I was feeling guilty about all three of those things, and it was unhealthy for me. Now, on top of that, I mean, that's just the word things that I was journaling about, that I was stressing about, that when I talked to other physicians, they were dealing with the same issues. But we also have family issues. We also have our health issue or our family's health issue. And again, we have finances that we have to worry about. These are all things that we take on a daily basis. And we're told to just suck it up, be tough, be strong, be more resilient. I believe number one, number four, and number six are probably the most important points for me in becoming more resilient. Is on those bad days, just know that tomorrow could be better and will be better. And defining a purpose. And that's something that I learned through my experience, is that I kind of lost the purpose of, I am here to help people that are in need of my education and my skills because I can help them and make them better. And that started to make me feel better again. And again, this Grand Rounds used to be one of the ways that we were able to generate relationships. I could see my partners when I started, we were like 300 docs from other departments and divisions. I could chit chat with them. I could get a bite to eat and sit down in the Timken amphitheater. And as we have become more digitally reliant, we have become more isolated. And you have to understand, if you didn't know this about me, I was not a weak person. I was a rock climber. I free soloed for a number of years. I was a skydiver. I was a base jumper. I dealt with stress. I dealt with anxiety. Nothing was making me nervous. I was fearful, or fearless, and I became fearful over time when I had my nervous breakdown. That was a new emotion for me. I loved being in the backcountry, grizzly bear country, whitewater rafting. Throw it at me, I would tackle any problem. So for me to not deal with what I was dealing with was a new problem. I gave my heart and soul to my patients and my practice. I, again, kind of expected this. I lost sleep, but as time went on, I became more anxious and I was having insomnia. I gave up dinners with my families. I missed anniversaries, and I was impacted on vacations multiple times. And it was part of my job, but it really started to eat at me over time. I burned out. I had a nervous breakdown. Um, for me, it was something that I just wasn't expecting, and something that really, really hit me hard. And I think the main reason I'm here today, and I've spoken to different people in different groups and podcasts and video forums about this recently, is that I have a YouTube channel. And I think my kids think it's cooler that I have like 35,000 subscribers and I'm more of an influencer than a dad or an orthopedic surgeon. But most of it is for patient education. But I decided one day to talk about my experience. And since then, a lot more people have seen it. And it's the one video I haven't gone back and actually watched. It's very raw, but people have seen this. And I explained everything because it was easier to do it there than to tell every single person I knew what I went through. And people have asked me to talk about it. And each time I talk about it, it gets easier. And you have to understand that you can be depressed and not have clinical depression, but I did suffer from depression. And you can be anxious and not have an anxiety disorder, but that hit me. And for me, for a long time, I was suicidal, and I, leading up to it, didn't realize it. So I think not only did other people, but even me looking in the mirror, didn't see the problems that were brewing inside. So I was living in this hypervigilant state. I was in sympathetic overdrive 24/7, in the operating room, in the office, at home, driving to work. I was waking up at 2 in the morning, couldn't go back to sleep. And then I started having panic attacks. It initially began on days when I was operating, and then it started to hit me on days when I was in the office, and then even on weekends. And it was one day, it was so bad, actually, after going surfing with my daughter that I couldn't get my breathing and my heart rate under control. And I went to the emergency room with what I believed was a heart attack. And, the ER was happy. I wasn't dying. So they were like, hey, you're fine. You're not having a heart attack. And I didn't really know what to do. So I had to seek out psychological care and found a therapist that was able to help me. I missed all the warning signs. And this is what's crazy is I was doing this lecture about burnout and I didn't see that I stopped exercising. I stopped meditating. I was not a alcoholic, I would say, but I was drinking 1 or 2 glasses of wine or beer a night because I needed to turn off my brain. I needed to sleep and nothing brought me joy. I just was completely unhappy. I went to Kenya with my son, and actually while I was there, I had a great time. And then I came back and I had a tooth infection, I had a tooth extraction. I was back in the thick of things at work. I was not sleeping and I just suppressed and overrode. And I just kept going because we don't have substitute teachers. I can't just not show up. I had a full clinic and a full OR schedule. I had to keep going. And one week just became the toughest week of my life. I felt like I was moving in slow motion, like my feet were in cement blocks. My brain couldn't think, and I literally did not sleep. I sat up all night in fear, staring at the TV or staring at the wall, and I kept going to work. And on Friday, after clinic, I felt like I couldn't move. And I called my therapist, and I was stuck halfway between the office and the parking lot. And she wanted to make sure that I wasn't suicidal, that, I should go to the ER if I could get there or get home. And I got into bed and I spent 3 weeks there. I did not get out of bed for 3 weeks. And my wife was petrified. She didn't know what to do. And I was really unable to care for myself. And luckily, I had a spouse and I had a therapist, and they worked together to get me into a program. Um, I realized that I didn't want to be admitted. And if any of you have heard of Lorna Breen, she was the physician that ended her own life. She was the ER doctor in New York during COVID. And this is the same fears that she had. Like, what would my partners think? What would patients think? Is the medical board going to find out about this? And what would happen to my medical license? So I was lucky in that I got into a outpatient program at Sharp Mesa Hospital, which is a psychiatric hospital, and they have a really strong outpatient program. And there were a lot of doctors, there were a lot of nurses, and there were a lot of military. And those three groups of people took up the majority of people there that were struggling. Um, I really thought about ending my life. I thought that life was hopeless and I wasn't going to get better. And that was the easy way out. And, we see this in healthcare. We see this in the military. This is Suicide Awareness Month. It does happen. It shouldn't happen. And we should do everything that we can to prevent it. Dr. Pam Weibel, who's a physician up in Eugene, Oregon, has become a huge advocate for preventing another physician suicide. And she has this counter and she talks to people. She's available 24/7. So she's someone that people reach out to at 1 o'clock in the morning when they're on that edge. But the scary thing is that when you read about some of the doctors that decided to end their life, nobody ever said that they were mean, upset, and angry, and depressed, and isolated. They were always the happy people. They were the people that doctors wanted to emulate. They had all of these great attributes, but we have to then ask, what was it that drove these people to decide that death was the only option? Now, for me, I got all the standard treatments. I got psychiatric treatment. I was put on medications. I received cognitive behavioral therapy through the outpatient program, and I did lots and lots of therapy. For me, meditation has been a really big cornerstone of my life. So I got back into that. I took John Kabat-Zinn's mindfulness-based stress reduction program. Like I tell all of my patients, sleep hygiene is important. Nutrition is important. Exercise is important. Put yourself out into the forest. Have more social connections. These were all things that I made sure I did on a regular basis as I started to heal. Now, things that I did, but things I even talked to my patients about when they were anxious before surgery or an injection, is breathing can help with anxiety. Sometimes just one deep breath can help. You can do box breathing. You can do 4-7-8 breathing. The other things that I learned were these ABC games and these counting games. These are great. ABC, go through the alphabet. Think of animals, think of foods that start with each letter, or count the number of things in a room. 4 chairs, 1 table, 2 windows. These are great things to teach kids, but you can't do them when you have a panic attack. You have to practice them when you're calm. So you're used to using these skills. So when anxiety arises and you recognize it, you have something that may actually help. Other things for me that helped were journaling and writing, which became a book that I published about my experience and ways that people can take care of their own mental health. I started sharing on social media, and it actually opened up doors to do lots of podcast interviews with people that wanted to discuss this on their platform. And then I talked to people like you and like friends and colleagues and even patients. And what I found was that a lot of times when I opened up, adults that I knew or patients that I knew that were older all of a sudden opened up and explained to me that they went through a similar episode. They had a nervous breakdown in their 40s, 50s, 60s, and they've never talked to anybody about it because no one ever brought it up. Maybe their spouse knew about it, but bringing it up, all of a sudden I realized there's other people out there like me. And this is kind of what I talked about in the beginning when Dr. Lagasse talked about the issues. This is back in 2000. He talked about malpractice being issues and credentialing, committees and administrative burden. All of this sound familiar? Insurance companies, healthcare rationing. 25 years later, same issues. And what he talked about is that you have to do things that are important that bring you joy. I read this in a book and I thought this was great, that really focus on eulogy virtues, not CV virtues. When you die, because we are all going to die at some point. At your funeral, nobody's going to get up and read off all of the book chapters that you wrote, or the articles that you wrote, or the number of surgeries or patients that you saw. But they're going to talk about the things that you did for people in need, or the trips you went on with your family. Those are the things that are important. I do think it's important to have these ideas of sabbatical and leave policies. There's a lot of institutions that after so many years, there's a paid sabbatical time that you can take in chunks or all at one time. And we shouldn't feel that someone's weak because they take time off of work. Prioritizing family time, it's something we even talk to our fellows about is, hey, let us know because family's important. This job's important, but family's important too. And exercise. There are so many physical and mental health benefits from exercising on a regular basis. I don't have the answers. So if you came to this lecture thinking I'm going to tell you what we should do to make everything better, I honestly don't know. But we all talk about the fact that change is needed. So we have to find ways to make the EMR more efficient. It's not going anywhere. And to decrease the burden of the electronic medical record. Those old quotes about for every hour of patient care, there's 2 hours of work on the computer. Pajama time is not healthy. Again, taking more free time and having time for sabbaticals is important. We need to reboot and refresh, especially as patients become sicker and more demanding. It takes a toll. Having health and wellness programs, and Dr. Fisher is going to talk about this. And I think all institutions definitely have to change the culture. So talking about this, speaking about burnout, seeing our colleagues that might be struggling, and being able to open that door to have the discussion, to not make people feel as if they're weak because they're struggling, but make them feel empowered by talking about their problems and looking for solutions to make their life better, I think is important. I do believe we have to destigmatize mental health, especially as physicians, because for patients, this is still hard. And for me, if I had a heart attack and had a stent put in and was put on Plavix, wouldn't think twice about telling everybody when I came back, oh yeah, I had a heart attack. I'm on Plavix now for a year. But as soon as we have a psychiatric issue, all of a sudden people get hush hush. We wonder how much we're supposed to talk about this, and should we tell people about why we were out and what we were doing and what's going on. And for me, it's gotten easier, but there's a lot of people that still are fearful of talking to people about the treatment they received. We are the canary in the coal mine. I believe that right now we are seeing doctors leave all over the world, nurses all over the world. They're leaving healthcare. And that means that there is a problem, but you're not replaceable. And I would like you to understand that, especially here, we have some of the most highly intelligent, super specialized doctors. You can't get a doctor just because they finish their boards in that specialty and fill your space. But at the same time, we have to look out for one another, because if one of us is struggling and they leave, we want to ask the question as to why, what happened, what's going on. If someone decides that they can't take it and they decide to take their own life, we need to talk about that and not throw it under the rug. We need to ask the question as to why, what could we have done differently, and make those that are still here understand that your life is important and that we feel strongly about your physical and mental health, that you're not just a cog in the wheel and that we can just replace you if you're not here anymore. Now, the good news and caveat to that is I was always afraid to take time off when I started my first 5 years of practice, but I couldn't go to work Monday. I went to work Friday, and my partners were excellent, and they picked up all the slack. All my patients that needed care, that had surgery scheduled, they picked it up. And I think so many of us here and at big institutions are lucky. Those that are in private practice don't have that luxury, but we have each other's back. So when you feel that you're struggling and you feel that you can't leave and you feel that you can't take off, just realize you're needed, but you can take off and someone else can pick up the slack while you're not here. Self-care first. All of us have been on an airplane, right? First thing they tell you, in the case of cabin depressurization, put your own mask on first. So important that we all need to take care of ourselves first, because if we do, we're going to be a better doctor. We're going to be a better husband, a better wife, a better father, better mother, better friend, but we have to take care of ourselves first. We also have to set boundaries. And this was something that I didn't know how to do well. Probably the first decade of life, I always said yes. I was a yes man because I loved it. Another patient, sure, add him on. Another surgery, sure. Surgery on the weekend, sure. But over time, that became a burden. And I felt guilty to say no. And I felt that I would be lazy in other people's eyes if I said no, even when I didn't have the bandwidth. So again, like those anxiety things, is you need to practice this, that you can't have a boundary in your head. And when someone asks you, you're stuck in a corner, you're going to say yes. But for me, things like, thank you so much for thinking of me, but honestly, I can't right now. My plate is full. I don't have the bandwidth for it. Please, if you think of me in the future again, ask me again. I might have time then. But have different ways like that just roll off your tongue. So when you feel overloaded, that you can very easily and safely say no. You need to set your own boundaries, and boundaries can be flexible, so they can change over time. When I came back to work, for me, it was part-time and I needed to set up self-care. So I used to work through lunch. And now I made time for lunch, and I made time to eat, and I made time to take a walk every single day. I brought in plants and put them in my office. I play music in the background. So between patients, I come back. It gives me something that allows me to kind of reset, especially after a difficult patient. Action before motivation. There's a lot of times we know we should do something, but we don't have the motivation, so we don't do it. So for me, it was even when I didn't want to get outside, I got outside. Even when I didn't want to go to the gym, I went to the gym. And you know what? Every single time I felt better. For me, again, meditation has been a huge thing in my life. It's not for everybody. It's very simple. It's as simple as taking your seat, putting your attention on your breath, and thoughts will arise. Label them as thinking, turn back to the breath. You can do it anywhere, but you can be mindful of walking. You can do walking meditation. You can be mindful eating, brushing your teeth. There's a number of apps out there. Calm, probably one of the most famous. I would really encourage you, because we're all physician scientists, to look into Healthy Minds Innovations. That's the one with Cord Dahl and Rich Davidson. And it's great because short meditations and active meditations, you can do it folding the laundry, but every meditation is then followed by the science, the view of meditation and how it helps our brain and how it makes us be more aware, and not only aware of ourselves, but others. And it can be beneficial in so many ways. They even did a study with doctors and found that those that went through a 12-week program actually became more empathetic to their patients. Book recommendations. So this is kind of more stuff that might help you. Into the Magic Shop, great book by the late James Doty. He was a neurosurgeon up at Stanford. This was kind of his memoir, but his introduction to mindfulness meditation by a woman that taught it to him. And every chapter kind of teaches you a little tidbit. Obviously I'm a little biased to my book, but I share everything that I just talked about and more, and all of the skills that I learned. And I teach people ways to maintain healthy mental health. And Todd Alton wrote this book with a patient of his. It's a really interesting read if you're interested. He also has a documentary coming out called Suck It Up, Buttercup, all about the mental health struggles and burnout issues that are facing physicians now worldwide. This is another thing. For me, this was a beacon. Physicians Anonymous, an incredible group of people. These are the times of each 1-hour session. It is completely anonymous. You will meet residents, you will meet young physicians, you will meet old physicians all over the world, every specialty. It is a safe space where you can just show up, come and listen. You don't have to say anything. If you want to share something, share something. But it is a group of people that are there to support one another, because they're all going through the same things that you're going through and that I went through. Specifically for any female surgeons that are in the office, Amy is great. I actually did a podcast interview on her platform. She does offer one-on-one coaching, but what's great is she has a very specific group coaching cohort for female surgeons, for people that have very specific things that you might all relate to, and you're looking for a group of similar-minded people. This is a great resource if you want to check that out. And I want to leave you with a couple caveats. So I never expected to not be able to work. I was lucky that during our residency, it was really impressed upon us to have life and disability insurance. So I had my own policy for a long period of time. When I went out, I had to go on disability. And what I found was that my own personal disability policy helped support me because, mortgage is expensive and raising two kids and kids that are in college is expensive. And when you're not working, finances are a stressor. I had disability that met my needs. For me, it's portable. So if you choose to change jobs, it goes with you. I had excellent customer service because it's a great company, because I paid with after-tax money, it's non-taxable. And for the time that I was out on disability, it was based on my pre-injury income. Now, the work policy, again, was there, and I never really looked into it. But when I went out, we only get a maximum of $10,000 a month. If you're a PA or nurse practitioner, it was $15,000 a month. I've been told that that's gone up to 12. It's not portable. So if you come here and then you leave, but between that time you have a health issue, now your insurance premium is going to be higher, or you might be uninsurable. I had a very poor experience with customer service. Because it is paid for by the group, it is taxable. Because we get state disability, they subtract that. So at the end of the month, that $10,000 policy, I think, came out to like $3,000 or $2,800. So if you have a mortgage or you have rent, you're not going to be able to cover your rent in San Diego with that policy. So you really need to think about what is your budget and what do you need if you, for whatever reason, can't work. And then on top of that, they recalculate after a year. So I went to work part-time and then they recalculated it. Basically, I get nothing because I'm working as opposed to my pre-injury level. Now, the other bonus tip I want to leave with you is for all the younger docs. I share this with all of my young partners and all of our fellows, is that when you have kids at the beginning of the school year, get their schedule and give it to your scheduler and block out all of those days when your kids are not in school. So they have an administrative day. It's not an actual holiday. Take the day off. They have a late start. Start late. Have breakfast with your kids. Go to work. That time goes so quickly and you can't get that back. Your kids don't care if you do another surgery or you see another 10 patients, but they are going to remember you having breakfast and walking them to school or spending the day at the beach because they had an administration day at school. So that's an important thing that I would strongly recommend at the beginning of everybody's school year for your practice. For me, going forward, I'm still trying to identify my new role as a non-operative orthopedic surgeon. I tried to get back into the operating room. I wasn't sure I was going to be able to. After attempts, I realized it's just not for me anymore. I don't have the bandwidth to handle the stress that comes with being a surgeon. And talking to some of my older partners that have gone non-operative, they've all kind of said the same thing. Wow, I can't believe how much stress I was carrying because I was just doing it. Now that I've stopped, I just can't believe what I was carrying for all those years. Now, what I have also recognized is that I am doctoring better. I believe a lot of surgeons tend to profile patients. And very often, if a patient was a non-operative patient, directly or indirectly, I recognize they're not going to fill my OR schedule. How quickly do I get this patient out of my office? And I'm sure you've all heard it from patients that have said, oh, the surgeon told me I don't need a surgery, that he's a surgeon, and I was supposed to come back when I needed an operation. They become very short visits. And now I can talk to patients. I'm not rushed. I see less patients than I used to, but I can give them more time and I can answer their questions and give them a plan and help them understand what's going on. And I can't believe the number of patients that leave my office now and tell me, thank you for spending all of the time that you spent with me. I can't believe how helpful you were. I feel so much better now. I have an idea of where I'm going. And for those that need surgery, I get to fast track them to my partners because I know who needs an operation and I can educate them all about the risks and benefits of surgery, which makes my partner's job a little bit easier. I am writing more. I'm working on writing. I realized I enjoy writing, so I'm doing more of that. I like patient education content. I continue to put up videos on my YouTube channel because I realize that a lot of patients out there don't have a lot of education about their medical conditions. And for me, it's been very fulfilling. But most importantly, I'm really trying to do this. So I'm talking to people on their podcasts or video platforms and lectures like this because I've realized that I felt this obligation to speak up and speak out. I've always been sort of a strong personality, and I, for a lot of years, really didn't care what people thought of me. Like, if you liked me, great, and if you didn't, so what? So I just came to this belief that if people thought that I was weak or that I couldn't handle things because I didn't have the mental rigor or the toughness, so be it. But the more I talk about it, the more positive I feel. And I see all of the people that reach back out to me about how important this was to hear from someone else. So they felt less alone. So they understood that somebody else was going through the same thing they were going through. And that I can share some of these skills that I learned that people right away can put into practice, and they're able to start to feel better or see the light at the end of the tunnel, that things are not hopeless and that they're not a failure. So I just want to kind of thank everybody for listening. It's actually great seeing a lot of faces on the forum, faces that I used to run into in Timken when we used to do this live. And that's the thing, I really kind of like running into people again. Like I saw Brendan Galis in the doctor's lounge one time when my daughter was in the hospital. I run into Gava on walks sometimes. So it's so nice, I think, for us to be able to see people and say hi and catch up and talk about the good things and also commiserate about the bad things. But for any of you that either want to reach out to me, I am open to talk to anybody that wants to talk sort of offline. Happy to get a cup of coffee, especially for the younger crowd. If you want a really great agent for disability insurance, call me, shoot me an email. And I hope that, at least one of you out there feels a little less alone today, that you take away some skills that can help you going forward. So thank you.